and essential discussion to have about what this means for our work as psychologists. And we have the pleasure of being joined by 3 experts to help us work through some of these issues. So first we'll hear from Rennie, who will discuss the history and process of current healthcare reform legislation and a rationale for why it's important. Rennie has been in the Senior Legislative and Federal Affairs Office in the American Psychological Association Public Interest Government Relations Office for the past 7 years. Rennie covers federal HIV/AIDS, health equity, and sexual and gender minority health. He is active in leading Washington, D.C. domestic and global HIV/AIDS coalitions and represents APA in national health equity policy matters. Rennie earned his BS from Georgetown University and has a master's in public affairs from Woodrow Wilson School of Public and Interventional Affairs at Princeton. After Leo, we'll hear from Amber Hewitt, who will talk about her experiences as a counseling psychologist working in Washington and what it's like as a member of APA working on these issues on the Hill. Amber Hewitt is the 2016-2017 Jacqueline Goldman Congressional Fellow, which is a position funded by the American Psychological Foundation and is affiliated with the American Association for the Advancement of Science. She is currently serving as a health fellow in the office of U.S. Senator Cory Booker in Washington, D.C. Her policy interests include education and child welfare. Before her role in the Senate, Amber was an assistant professor in the Department of Psychology at the University of Akron. And our webinar will then end with Anneliese Singh, who will discuss the connections to counseling psychology and our social justice mission. Anneliese is currently the VP of Diversity and Public Interest in Division 17. She's a professor and associate dean of diversity, equity, and inclusion at the University of Georgia and co-founder of the Georgia Safe Schools Coalition and Trans Resilience Project. Her counseling and psychological research, practice, and advocacy has centered on the resilience of trans youth and people of color, survivors of trauma, and social justice and empowerment training. And I'm your host, Bryana French, Director of Communications and Technology for Division 17, and soon to be, as of September 1st, Associate Professor at the University of St. Thomas. So a few logistics about our meeting before we dive in. Your microphones are all muted, so not to interfere with the presenters. However, you can certainly ask questions at any time. Just type them into the question box, which is on your right-hand panel, the GoToWebinar control panel, and I will turn my webcam back on and interject when appropriate to ask panelists your questions. And we'll do that after each presenter in case you have questions after the speakers, and we'll save plenty of time at the end as well for discussion. So without further ado, we'll begin with Rennie. And I'm going to switch gears and switch our slides. So, okay. 1 second.
Great. Are they coming up?
They are.
Okay, oh good. So you can hear me well enough?
Yes.
Great, there we go. Okay, great. So good afternoon, everyone. My name is Rennie, and I work in the Governmental Relations Office at the American Psychological Association. Next slide, please. And one more.
Okay.
Oopsie. Maybe one back. Maybe one back. Maybe it's not there. Okay. Well, keep going down a couple.
I think it might be hidden.
Yeah, there's one. Oh, I thought there was an overview slide.
Yeah, there sure is.
Yeah, there's that one. Yeah, that one. That's the one I want. There you go.
Okay.
Great.
Thank you.
Thank you. Okay. So, my task today, I think, is just to give a bit of an overview of the U.S. Congress, and I know some of that might be, I just want to give a big picture, sort of to give a context of what's going on in Congress and how, you know, bills are made into law, so to speak. And so I know that this group is, you know, sophisticated on these issues, but most of what I'll talk about and where we're gearing, I think, the webinar to and the other people will sort of round this out is trying just to give you a sense of what's going on with respect to Congress. And so first, again, I'll talk a little bit about Congress and the structure of it, but not too much, and that's like a little advocacy piece of it. And then we'll get a little bit more specifically into the healthcare reform bills that are being discussed and debated in Congress right now. And specifically, there are three things that we'll talk about. First is the Affordable Care Act, which most people, or the Patient Protection and Affordable Care Act, which, as you know, was enacted into law in 2010. It was a major accomplishment of the Obama administration. And then we'll go on to talk about two bills that are being debated and discussed in the Senate, in the House and the Senate right now. These are more commonly referred to or known as the repeal and replace bills, is what you've heard them referred to as in the media. So the first one is the American Healthcare Reform Act, which was just passed in the House of Representatives, and the Better Healthcare Reconciliation Act that's being discussed in the in the Senate rather. And then I'll talk a little bit about potential outcomes, and I think that'll be a good segue into what Amber will talk about towards the end in terms of foreshadowing what we can expect to come out of this whole discussion on healthcare reform that's going on right now. Next slide, please. Almost. Nope. The other way. Sorry.
That one?
There we go. Yeah, that's right. So there we go. So real quick, and again, not to be too rudimentary, but there are two houses in the legislative branch, and the legislative branch is responsible for making laws. So Congress overall has 535 members, 100 members in the House, and 435 members in the Senate. And on this slide, we just have addressed as senator or congressman or congresswoman or representative if you're ever talking to one of them directly, or if you have to send any correspondence, it's appropriate to talk to them as such. Next slide, please. What does Congress do? And there are three basic functions, I would say. One is to pass new laws. Two is to authorize programs and appropriate funding. And three is to inform and influence the administration. And just real quickly on number two, the authorizing programs and appropriate funding, that's really what's going on right now with respect to the whole healthcare reform and the repeal and replace conversation. Like I said, in 2010, the Affordable Care Act was enacted into law, so that's authorized. But if they, in Congress, pass any of these two additional bills that I just mentioned, the AHCA, the American Healthcare Act, or the Better Care Reconciliation Act, those would be new acts of legislation or new laws that would be enacted into law. The other piece of it that just is a little bit in the weeds, but not too much, is that Congress, after they authorize a program, you need to have money that goes along with it. So you can have a program, but there has to be a step where both houses act and appropriate some funding to your piece of legislation. And that'll become a little bit clearer and relevant as I go along a little bit more. Next slide, please. This is a nice visual. I won't spend too much time on it, but again, this is like Civics 101. Go back to, think back to high school. You know, bills technically need to be introduced by either the House or the Senate. The term regular order, which you hear them saying on TV all the time, is that we don't have regular order anymore. What's supposed to happen when a bill is introduced in either the House or the Senate is supposed to go into subcommittees to be discussed and marked up. And the term marked up just means to have amendments, or people discuss the bill in committee and they come up with a compromise or something everybody can agree on. Then it moves, presumably, out of committee to the whole floor of the House or the Senate, and then it's voted out of the House and the Senate. Sometimes it'll be done what's called a conference committee to reconcile differences between the two bills. Then ultimately it appears in the president's desk. So again, not so much that you have to remember all this, but it will become a little bit interesting as you sort of continue to follow what's going to happen with the Senate bill. Well, it's not even a bill yet in the Senate, but it'll be very interesting to see how things progress in the Senate. They're not following regular order, and they're not doing exactly what I've just sort of outlined, but that's sort of really what's the interesting thing about where we're at with Congress right now and with the new president. Next slide, please. Won't go into this too much, but again, you can refer to this a little bit later. But this just sort of tells you what the federal budget process looks like. The long and the short part of it that I'll leave you with, unless there's more questions with, that funding legislations or appropriations bill are supposed to start and are supposed to be passed by the House and the Senate. is supposed to agree on these different bills. There are about 12 appropriation, different subcommittees. Each one is supposed to come up with funding for various federal agencies. They're supposed to vote it up or down out of both the House and the Senate, and then the president is supposed to sign what's called the appropriations bill. And that has not been happening and working the way it's supposed to for the past several years. So again, as you see the conversation around the Senate bill and reconciliation of the House and Senate bill, there's also going to be a conversation around funding that's happening for FY 2018. And so they become more, nothing, again, is happening in a normal order, so it becomes a little bit difficult to follow everything, but there are two different processes and things that are happening right now. There's the budget process and getting a final signed FY 28 spending plan, and at the same time, they're having this healthcare conversation, which has a lot of budget and appropriations implications at the same time. So again, not so much that you need to know all the nuances of it, but just know that those two things are happening at the same time. Next slide, please. Okay, and this is just a little overview, not to spend too much time, but just to give you a little picture of what Congress looks like, and it's a nice video, a nice image. I think this is the House and the Senate. You see that the minority representation is about 102, so 102 out of 435 members in the House. That's maybe about a quarter or so are minorities. Women, again, not doing too well on either side of the House or the Senate. We need more representation of that. So you can see that, African Americans are 46, it says on the House side. I think only two now, three in the Senate side, not too well. So we need more diversity on both the House and the Senate side, but we're working on that with various elections. Next slide. And this one just gives you LGBT. On the left side, a total of 7 LGBT members, 6 in the House, and these are all easy enough to find. 1 in the Senate, that's Senator Tammy Baldwin, who used to be in the House, and she's in her first session of Congress right now. And on the other side, you just have religious breakdown as well. Next slide, please. Oops. There you go. And this one I just thought would be fun for you to see who are psychologists in Congress. So it looks like there are about 5 of them altogether, all in the House of Representatives. We have both Democrats and Republicans, as you can see. So if anyone lives in their district or anything like that, it might be interesting. Judy Chu, interestingly, she belongs to the Minority Fellowship Program. Tim Murphy has been very important in the mental health reform legislation and bills that have passed recently. And he has been very active and led a lot of that. And it's actually in the opioid discussion that's going on right now, too, in the context of this healthcare discussion. Next slide. And, oopsie, go back one more. There you go. So the one that's okay. The one right before it was just a list of different issues or just trying to give folks, again, I'm not sure where everyone is comfort level or knowledge level of or participation in advocacy and policy has been, but, psychologists have an impact or can have an impact on vast, many, many different areas of legislation. So mental health parity and mental health, access to mental health care, health equity, healthcare reform, and all things like that. This one just showing right now, why should you take action? This is just our little pep talk slide. If you're thinking about taking action or becoming more in advocacy, there are a lot of reasons and ways you can do it. Psychological knowledge can contribute to analyzing, understanding, and resolving key problems facing our nation. Federal state policies affect our welfare as individuals, educators, researchers, practitioners, and students. And if you don't speak for your field and for whom it benefits, who will? And that's really true. And I'll say a quick aside, the Minority Fellowship Program is hosting its annual institute right now for its fellows. And I just got back this morning with doing 2 visits with one of the MFP fellows, and she really, I think, enjoyed it. And all of them are going out and doing Hill visits right now as we speak. So we do that often, or to the extent that we can here at APA. We try to integrate or incorporate some sort of an advocacy component into any fellowship or activity that folks are having with us. Next slide, please. Oh, okay, maybe I was out of order. Well, that's the slide that I was talking about with the different areas of psychology's contributions to public policy. So again, I won't go into that, but again, if you just check out our website or things like that, you'll see you'll see how involved we are in these issues. And again, after this, feel free to email me and I can connect you with whomever's working on these issues. Okay, we can do the next one. And this is just a nice slide of our 2011 APA president, Dr. Melba Vasquez. She is one of APA's top 5 most active grassroots advocates. I won't read you this quote just for the sake of time, but she was president. I started here at APA in 2010, and I remember she was incredibly active and did so many things around advocacy here. And she was also an MFP fellow as well, and she still has played a lot of done a lot of work with us here in our office to move different things forward. Next slide, please. Okay, and so now here we are into the heart of everything. And I don't think that, the purpose wasn't so much to tell you everything that's in each of one of these bills, but just to sort of, again, give you some of an overview in the context of what's happening. And so, again, just for reference, so we know PL 11148, that is what we refer to as the Patient Protection and Affordable Care Act, or the ACA. And that was enacted in 2010, signed by President Obama, and it provided high-quality health care coverage to more than 22 million people who were previously uninsured. So that's what we have in current law. The bill did a lot more than that, but the basic point is that 22 million people now are insured currently than before the enactment of the ACA. HR 1628, that's the American Health Care Act, and that was the bill that just passed in the House of Representatives, I guess last month on May 4th. I hope that's the right date, but that's the bill that just passed by a very narrow margin in the House of Representatives. That's the one where you heard about like 23 million or so people were going to lose their health insurance if it was enacted. The premium, of course, is going to go up, huge cuts in Medicaid and all those sorts of things. That's the bill that was just actually passed in the House. The bill, and it's not even a bill yet, on the Senate side, is called the Better Care Reconciliation Act. The Senate Republican leadership released the working draft on June 26th. The bill has not yet been introduced. When we wrote this slide yesterday, I said revised draft is expected today, and in fact, about an hour ago, the Washington Post and media are reporting that McConnell will or has just released the draft, and so that is circulating now. We haven't reviewed it yet. And McConnell says that they're going to delay the Senate to August recess. They were supposed to go out on August 1 on vacation, but he's keeping them for 2 more weeks, which means presumably they'll be working on the health care bill or on the health care compromise to get something introduced. Next slide. Again, you can look at this quickly again, but I just took this from our website, the APA website. We have been incredibly active on this issue. Like even before the new session of Congress started, APA issued healthcare reform priorities for working with Congress and the administration. There are 6 core areas or priorities that we have: establishing universal access to essential healthcare services, including mental health and substance use services, enforcing consumer protection, integrated care, that's a huge priority for us, access to preventative services, and this should be important to Division 17. There are requirements. One of the essential health businesses is screenings for different types of disorders, which is very important, investments in the mental health workforce, and increased funding for research and transitional research and behavioral research and training. These are our priorities, and much of that was accomplished within the ACA. And actually, in both of the bills, the healthcare one in the House and all the proposals in the Senate would negatively impact all of our core objectives on these things with APA. Next one, please. Next slide. Here's a nice little visual. CBO score confirms Senate bill's devastating impact. It will result in 22 million people losing coverage, Americans losing coverage, 20% increase, premiums will increase 20% for hardworking Americans, and $772 billion in Medicaid cuts. And that's a huge amount of Medicaid cuts. And I don't have to tell this group how important Medicaid is for so many different populations, for all the disparity groups that we're concerned about, women, immigrants, the whole spectrum. You know just as well as I do how important Medicaid is. And this program, this decimates, both bills decimate Medicaid. Next slide, please. And here's our little visual. And, a lot more materials, but 10 top reasons why we want to kill the bill. And we are very opposed to this bill. Arthur Evans has done a video, if you haven't seen it, it's on our website. But we're incredibly opposed to it for all of these reasons: millions to lose coverage, higher premiums, higher out-of-pocket costs, harms efforts to stop overdose deaths because of the Medicaid cuts. And just as an aside, they are talking about adding like $45 billion for opioid. Any new money is good, but as you know, to really deal with the opioid problem, you really need comprehensive services. You need integrated care, because a lot of folks of these people have comorbid conditions. So, the $45 billion may be able to fund some categorical things, pay for some medication, but it's not going to really go the way we need to really provide the comprehensive wraparound services you need to really have an impact to deal with all the mental health challenges that folks with addiction face. Hurts mothers and children, any population you want to name, huge cuts to school Medicaid, disabilities cut, services cut, older adults, stops progress in health equity, and I could talk to you about that next time ad nauseum, and it will increase medical deaths for lots of people. So we are very actively involved in fighting this bill. This is not over yet. We'll be sending out more action alerts. And so we have a group called the Federal Action Network. I don't have the link up there for this, but I can always get that back out to you. So I think that's my last one. And so I'll stop there. I hope I did it within my time limit. And so I'm happy to take any questions if there are any, or we'll just move on. Thank you so much and thanks to the organizers in Division 17. This is such a nice thing. I'm so happy that we're developing this partnership, and I got to speak with you today. Thank you.
Thank you. Thank you. So now we will take questions for Leo's portion. Did anything stand out to participants that you want clarity on or chime in about? Feel free to type your question in the question box on your control panel. In the meantime, I will get Dr. Hewitt's slides ready.
I can ask you a question.
Sure.
I didn't have any questions on the question box, but what's it been like for you to kind of be in the heat of it all and watching this all go down? Because I think one of our roles as counseling psychologists is, help folks, but we often don't know what this feels like on DC unless you're like Amber and you're doing the work, or like you.
Yeah, well, I need to make an appointment soon. It's really, and I was just again talking with the Minnesota person who I was with this morning. This is really, and the staff person. The staff, we went to Stabeno's office, and you can walk underneath now you can go back underneath from the House to the Senate and go underneath the train and all that, which had been shut down for a long time. And we were talking to the staff people, and it's just so unprecedented. That is really true, what they're saying on the news. And nothing is ever like this. And Amber will talk about this more. You just don't know what to do. And the whole regular order conversations I talked about, you know that if you follow, the way it's supposed to work is that they'll say, this is what we're going to do. So the advocacy community knows what you're supposed to do. You have to respond to the president's budget. You have to respond to the appropriations bill. There's rules to this game, and it orders your work. And they're supposed to communicate with you. They're not supposed to lie. And I'm not really being partisan, but it's pretty clear that this administration is not telling the truth on a lot of things. And so really it makes a difference. So I think the biggest thing is uncertainty. Everybody said that the American Health Care Act wasn't going to pass. And it wasn't going to pass. It wasn't going to get out of the House, and that was conventional wisdom. It wasn't going to get out of the House until it got out. And so we didn't know what to make of that, and that's going to be the same thing. I'm hoping that this bill in the Senate, that it won't become a bill and it will die, and that's what everybody is saying, but it may still happen. So it makes us have to be more vigilant and making sure that we're getting but I think really, if you ask anybody, it's just the uncertainty and not knowing how to do your job and trying to be flexible around it. But it really is the craziest thing. The flip side of it is historic making, I guess, and it'll be nice to say we were here, but it really is just the uncertainty, and so many things are unprecedented and not playing by the rules, I guess. The whole regular orders thing, I think, is really, they haven't haven't had a regular order in a long time, but even the not having the regular order had a regular order to it. And all of that seems to be out the window right now. So that's all I'll say.
And it sounds like one of our roles might be able to just be in offering support to folks who are doing the work. But
and I say that all the time when I get to talk to members or students or anyone, really, and that's why I think we like to find these opportunities for our members to come to the Hill. So you can talk from, I'm not a psychologist, I can translate and know how to talk to policymakers, but it's so much different when I have the first sentence on an issue, but it's so much more important for, and a different voice for members and with your expertise. Even if you haven't done it before, you have the next sentence, you have the next 2 paragraphs to explain why it is APA has these positions and the things that we take. So really, it is nice to be able to talk about it, and we love when members get involved and stuff. So that's great, and just to be listening for us, that's great. If you maybe come and have like office hours here for us, would be nice.
Thank you, Anneliese. That was a good question. And we'll have more time for question and answer, of course, at the end. The other thing I forgot to mention in our intro was that the webinar is being recorded. And so if there's something you missed or want to go back to, we will show it on the Division 17 YouTube site. So that should take, I don't know, a couple weeks or so, but stay tuned for that. So without further ado, we will switch gears a little bit and transition to Amber's presentation, who will talk about what it's like being on the ground and working in the Senate. As soon as I figure out, again, how to share my screen. Okay.
All right, so thank you, Bryana and Leo, for setting me up for my portion of the presentation. So welcome to this very timely webinar. When we were planning it, we had no idea that this second round of the Senate bill would be, or the draft discussion would be out today. So again, it's very timely that we're talking about all of this today. So I'm going to start my portion of the presentation talking about my route to Capitol Hill and go into more specifics about some of the healthcare reform issues that Leo talked about during his presentation. So as Bryana mentioned, I was an assistant professor in a psychology department before this fellowship. I had no idea, he asked me even, I don't know, like 2 years ago, would I be working on Capitol Hill? I couldn't have envisioned it. So I'm very grateful to APA and the American Psychological Foundation, which funds my specific fellowship. So APA typically hosts up to 2 psychologists per year to work in Congress. So you can either work in the House of Representatives or the Senate for personal members, or you can work on a variety of those congressional committees. In my case, I work for Senator Cory Booker, who's the junior Democratic senator from the state of New Jersey. And I work with 2 permanent Hill staffers who make up the health policy team. And typically when you're talking about health policy on the Hill, it can range from different issues. It can range from physical health and mental health and sometimes child welfare. So this year has been a year of transition. So a year of transitioning from research and practice to policy, and also a year of transitioning from primarily focusing on micro system issues and mesosystem issues to working more on sort of the macro system of public policy. So on a day-to-day basis, you know, it looks very different. If I was in the office right now, I would be sort of reading all of the articles and looking at the discussion draft of the Senate healthcare bill that, if it hasn't already, I think Leo mentioned maybe an hour ago, was released today. But on a typical day, I'll be meeting with advocacy groups. So if you have the opportunity to go to Capitol Hill or go to your state house, you meet with staffers. So I will be one of the people that you would meet with and advocate and share your points too. I've also had the opportunity to write policy memos on a variety of different topics and also recommend that the senator co-sponsor specific legislation that fits within his priority areas. And I've also had the opportunity to assist with writing talking points for things such as floor speeches and media opportunities. So now I want to switch with a little bit about sort of what it's like to work on the Hill. So if we could go to the next slide. So a counseling psychologist in the Senate, and I put a question mark on that because sometimes I'm walking in the halls of the Senate or just walking, usually from my Uber and not the train, into the Senate building. I'm sometimes amazed that I'm here, and also questioning how did I get here, and also grateful for it and grateful that I could be in this role. And Anneliese's question about sort of what can we do and just providing support. Some of my peers have said, oh, we're so glad that you're there. And I don't really always feel like I'm doing enough. But it's an historic time, but historic for, reasons outside of the usual positive connotation of the word historic. So I want to draw on 3 aspects of counseling psychology and the different sides of those issues and what it's like to work in the Senate. So the first is social justice training. So our value of social justice and the training that we receive in graduate school. So social justice is the lens through which I conceptualize my clients, the lens through which I conduct my research, and is a huge part of my professional identity. And sometimes working on the Hill, you may work with staffers who state that they possess a social justice identity and understand what that is, but that may or may not align with your perspective of social justice and how we're trained as psychologists to understand sort of barriers and inequities and the intersection of our social identities and oppression and how all of that is intertwined and impacts our well-being. We're also trained to respect the strengths within individuals and communities and value and respect the agency that individuals and communities have. And sometimes in public policy, it feels like people and communities are the objects of policy instead of the subjects of policy. So that's something that I've thought about and processed a lot. When it comes to our clinical skills, I consider myself, a pretty decent clinician, and I thought I knew how to communicate with others and be empathic and listen. But our clinical skills, such as being empathic and most importantly, listening without judgment or without an agenda, isn't always the case. When sometimes in order for me to do my job well, and maybe meeting with other staffers or meeting with advocacy groups, in order for me to do my job well, I have to go in there knowing what that advocacy or lobbying group's agenda is and knowing what my boss, the senator that I work for, what his priorities are and being able to communicate that. So sometimes I'm sitting in there and trying to, process nonverbals and look at body language, but like Amber, no, you aren't a psychologist right now, you aren't a teacher, you are here as a policy fellow and here representing a member of Congress. So that's been very interesting. And the third aspect is this concept of knowledge brokering. So I had a class in my graduate program taught by Elizabeth Vera on advocacy, and we talked about this concept of knowledge brokering and how psychologists, we have specific expertise and knowledge in different aspects of psychological science, and usually policymakers are inundated with a variety of different topics, and that we have the ability to broker the sort of the gap between sort of their broad areas of focus and our specific expertise. So this has been a steep learning curve of being better able to communicate psychological science to policymakers. And then the perception of others. So as Leo mentioned, all of the psychologists are in the House of Representatives, and only one of those is a practicing psychologist, Representative Tim Murphy. So they're as having an advanced degree or having a PhD or being a psychologist, when I'm in the room, people may not know what that means or really understand our profession and what we can bring to the table and what we can contribute, and that we are scientist practitioners. Yes, we're, that's the identity that I hold, being a scientist practitioner. I understand psychological science, and I also understand the practice of psychology. So next slide, please. So what does advocacy look like? So I borrowed these from the advocacy competencies of professional school counselors, and you can think about these as 2 sets of 3. I'm going to quickly go over them because I want to get into some of the more specifics of the healthcare reform debate that's going on now. So the first 2 are knowledge and disposition. So as counseling psychologists, we have knowledge about resources, how to link clients to resources. We have knowledge about advocacy models and systems change. When it comes to disposition, typically we came into this field because we are aware and embrace our role as advocates, and we seek to eliminate inequities and barriers that impact individuals' well-beings. But there's also a skill when it comes to advocacy, and I'm still learning that skill even though I'm almost done with my fellowship. So some of those important skills that are important are communication skills. So being aware that your worldview and your worldview and perspective may not, again, we know this as counseling psychologists when it comes to our clients, but also having that same framework when we're meeting with people on the Hill and we're meeting with Hill staffers. So I had to be more intentional about how, what, where, and to whom I communicated our science, our psychological science to. Also, we as psychologists, we have the skills of identifying and assessing problems, but when you're working in a policy arena, particularly in this climate, it's very partisan and very hierarchical. So how do we navigate a different system in order to get our point across? And then the last set of three kind of overlay those knowledge, disposition, and skills, such as being aware of leadership, that you don't always have to, quote, lead from the front, being able to collaborate and understanding systems change. So that was just a little backdrop of what advocacy looks like and how our training aligns with advocacy. So next slide, please. So this is a very interesting slide. I sort of look at it and I get flashbacks from meetings of when I wish I would have stepped up more in meetings with advocacy groups or just meeting with my colleagues in the office that I work for. So how can we have a seat at the table? So as Leo mentioned, and as we know, given this current time, we're at a very critical moment when it comes to policies affecting the well-being of Americans, and we psychologists need to have a seat at the table. So I want to talk about some more obvious issues where we may see ourselves at the table, and then some, I guess, more distant issues where we may not see the intersection, but sort of bringing to light that really psychologists and mental health should be at the table of all policy issues. So the first one is mental health parity. So I think Leo briefly mentioned this. So the ACA built upon the Mental Health Parity Act of 2008, which required all individual and small group plans to treat mental health coverage and substance use coverage at the same level as physical and medical services. So it'll be really important to see what happens in this new rollout of what happens to mental health parity. So when it comes to addiction, Leo already mentioned, I think, the $4.5 billion that would be given to states over the course of 10 years, but is that money only going to medication-assisted treatment and not to counseling and therapy? When it comes to maternal and infant health, one of the things that the ACA did was authorize a program called the Maternal and Infant Early Childhood Home Visiting Program that provides services and supports to pregnant women and family who are at risk to lots of adverse outcomes. So that's another thing to think about in the role of mental health when it comes to maternal and infant health and mortality, which is on the rise and in the US sort of rivals lots of developing countries when it comes to both maternal and infant health. So I want to focus now on some other issues that we may not think about that we should have a seat at the table, but I think we need to be at the table. So when it comes to issues such as caregiving, we have tens of millions of unpaid caregivers in the US, and some of us may be a part of that million, where we're caring for an older parent or a child with special needs and disabilities. What are the mental health aspects that go along with that extra role? When it comes to issues such as food policy, when we look at programs such as Women and Infant Children's, WIC, and SNAP, formerly called food stamps, which is sort of under attack as far as how much money will be appropriated to those programs. We know the intersection of physical health and mental health and how physical nutrition can impact your mental health. When it comes to issues such as criminal justice, so APA provided a letter in support of a bill that Senator Booker just introduced called the Mercy Act, which places restrictions on solitary confinement of juveniles who are incarcerated. So we know we have the research on the negative impact of solitary confinement and mental health. When it comes to issues such as environmental justice, I was able to work on an issue called neglected tropical diseases. And when we hear that term, when we think of some, different country of, diseases that are affecting remote parts of the world. But in the United States, people who don't have access to adequate sewage, they are interacting with what we're calling neglected infections of poverty, and what are the mental health implications of that, and how much funding is going to those programs. Social determinants of health, I'll skip that one for the sake of time, but psychologists also need to be at the seat of the table when it comes to education policy. We know that most mental illness starts in adolescence, and schools have a unique opportunity to identify and treat mental illness. So next slide, please. So what are the benefits and challenges of public policy work? And again, I'm still processing this new role, and this is a role that I plan to pursue throughout my career, sort of staying in DC working on federal health policy. So it's taught me to better communicate psychological science and how to do that with policymakers, and that's an ongoing process. I've had to understand the policy-making process that Leo talked about. Again, I mean, I knew the 3 branches of government in the Schoolhouse Rock song, but you know that that didn't cut it in this new role. And also that politics and policy go hand in hand, and that's been something very difficult for me to grapple with. And then also knowing that this is a multi-lane highway. So we're on the highway with other clinicians, such as social workers and psychiatrists. So how can psychology and psychologists partner with other stakeholders to uphold APA's mission, which is to apply psychological knowledge to benefit society and improve people's lives? So on the last slide, I'll just spend a minute or two, and hopefully we have time for questions since I'm kind of breezing through some of these topics. Issues to put on your radar. So when it comes to healthcare reform, there's an amendment that is in this new bill. We'll see what changes from Senator Ted Cruz that will allow insurers or insurance companies to have at least one plan that does not cover the 10 essential health benefits. So the essential health benefits was something that all ACA plans had to have. And there are several benefits that directly relate to our field, such as mental health and substance use services, outpatient care, and prescription drugs. It also cuts Medicaid. So how does Medicaid affect our field? So Medicaid, 45% of school districts fund therapy for children. It also funds transportation for clients to get to appointments. And it's also, Medicaid is also the primary payer in the US for opioid and addiction and substance use services. I already touched on points 2 and 3 and also 4. So I'll skip to health disparities. So the ACA allowed more communities of color who were implicated by health disparities to have access to treatment and prevention services. So it's important to think about health disparities also when it comes to healthcare reform. And then investments in research and training. So the ACA improved workforce training and development, which promoted models that integrated physical health and behavioral health. So it'll be important to see how much funding goes to graduate medical education, how much goes to sort of funding psychology graduate training and psychology postdoctoral training and fellowships. And then lastly, I just want to end on, don't forget the points of connection. So we're talking about healthcare reform, but as you saw in some of the other issues that we talked about, we should be at the table at a variety of policy issues. So hopefully this provided a little bit more context and points of connection of how we can get involved. Now we'll pause for questions, or if we're transitioning to the next presenter.
Thank you. Yes, thank you, Amber. I am learning so much as I'm listening and hosting at the same time. So similar to after Leo's presentation, we'll pause here if you have any questions for Amber. And if not, then we will wrap up with Anneliese and her connection to counseling psychology.
Awesome. Bryana, I'm very much in the mind space you are. I feel like just stunned with the good summaries by Leo, and just the challenge to do something and to be creative about that, and the specifics of how policy actually happens, how legislation happens, and Amber's very recent and current experience of what that feels like. I think over the last, how long has it been since November? I've lost count. It feels like years. We've been talking about some of these issues and really struggling in a pretty polarized and divided nation, and I would say in some ways world. So I really appreciate being on this call, and thank you for Bryana for organizing us all. My job is just quickly wrap this up and remind us of the connection to counseling psychology. And I think Leo and Amber already got us started with that. But I think where we're sitting right now, when we think about those points of connection Amber challenged us to think about, it brings up issues of what is the truth, Are we brave enough to start a conversation that matters? And then what does that actually look like? So we can go to the next slide. We as counseling psychologists know how to do clinical work, research work, and I think advocacy is where what we're talking about today, there are really so many gaps. And part of that conversation is knowing the bigger context of where we are right now with a discussion of ACA. The socio-political environment, those socio-political seems like a big, heady word, but it's exactly the things that Amber and Leo were talking about. It's not just a word in a textbook. It's not a word we throw out in a class or saying we value advocacy, but it's really understanding, like, what is the impact of a world where we're living in fake news and alternative facts, right? We study theories of counseling that don't go back to the motherland of Africa, that don't include indigenous modes of healing. So, I mean, the fake news, it's not just recent, it's been a long time, and it's all over the ACA even before we talk about what an ACA could look like. We have the Black Lives Matter movement, which is a continuation of the Civil Rights Liberation Movement and Black Heritage Liberation movements throughout time and around the world. We've still grappled with, can we say Black Lives Matter? Do we try to say other lives matter? Is it okay to just say, like, how does ACA, you know, intersect with the Black Lives Matter movement? In Division 17, we've written a very clear statement of support for that movement. And then we've got folks like Caitlyn Jenner and Supreme Court cases that are really debating what bathrooms people should use, when we know that it's not, you know, cisgender men or women that get hurt in bathrooms. It's actually trans people that get murdered, they get maimed, and they get really hurt in bathrooms. And then the whole conversation about pre-existing conditions and everything else we've been going through for the last few months and even before then. So just to remind us that if we're feeling weary right now, if we're feeling overwhelmed, like, it's not surprising, but let's go to the next slide. And so that's why it's important to think about, okay, what is our role? We as traditionally trained counseling psychologists are trained in the practice of counseling, but what do we do with individual clients, with group clients? We help people move through ruptures and disconnections in individual and group relationships, but those are the same skills we can bring to advocacy. We can think about, as counseling psychologists, what is our role? Do we even believe in this advocacy thing? Who are we? Like, what does it mean to be a counseling psychologist? What do we actually believe in? And what are we willing to stand up for? I think so many people who are impacted by the ACA aren't going to come out and say, hey, like, will you stand up for me? You know, we're going to have to move forward and say, this is important enough to take a stand. And that might be in the academy, it might be in how we teach our classes, and it might be even in how we work with clients and check in, how are they dealing with this? This discussion is not devoid from constituent groups, as Amber shared. And then who do we stand up for? Is it just us and whether we're going to get Medicare reimbursement or Medicaid, or are we standing up for a larger community? Let's go to the next slide. So I know this is a lot of words on a slide, but I want to read them, and you can just kind of guess who said this. You who are in the field of psychology have given us a great word. It is the word maladjusted. This word is probably used more than any other word in psychology. But on the other hand, I am sure that we will recognize that there are some things in our society, some things in our world, to which we should never be adjusted. There are some things concerning which we must always be maladjusted if we are to be people of goodwill. We must never adjust ourselves to racial discrimination, racial segregation. We must never adjust ourselves to religious bigotry. And we must never adjust ourselves to economic conditions that take necessities from the many to give luxuries to the few. We must never adjust ourselves to the madness of militarism and the self-defeating effects of physical violence. Maybe you've already guessed who is saying this. It's Dr. Martin Luther King in an address to the APA in 1967 of September, and he had just he was a Nobel Prize winner at that point. He was just 38 years old. So his message is so relevant for ACA right now, right? Do we just think about the debate that is going on Capitol Hill? Do we just think about constituent groups? Or do we think about what's happened over time? And adjust ourselves as counseling psychologists, we are currently in the, I don't want to say battle, but we are in this line of advocates that we have an opportunity to take those risks and to refuse the madness and actually say that, you know, what are we maladjusted to? It's a world where healthcare is not a guarantee. So let's go to the next slide. So what that means is returning to our role and really answering Dr. King's question. If we don't stand up and talk about ACA, we really, I think, are helping people adjust to oppression. And so how can we challenge that and really change what we're doing, even in the next few days? It is not too late. Let's go to the next slide. So Amber, I love that she talked about the advocacy competency domains. This is a lesson we can learn from the American Counseling Association. Hello, counseling psychologists out there. Why don't we have advocacy competencies ourselves? Well, I think APA would say, because we don't want to get sued, sorry. But on the other hand, it's such an important role, right? And why isn't it policy within our own organization? I just wanted you to be able to see the original kind of diagram. It's kind of this Rubik's Cube of sorts that Amber talked about. And you can see she was saying we really, when we're talking about in this webinar, is working on the right part of this cube in the public arena, working on public information and social and political advocacy. And let's go to the next couple of slides. The next one really looks at that, how do we act, well, maybe they're not there. Let's stay on this slide. So if we're looking at that, the left part of the cube, you can see using the advocacy competencies by Lewis et al. 2003. On the top part of the cube, going left to right, you can act with clients, students, etc. Or in the bottom row, you can act on behalf of folks. The work Amber and Leo are talking about with ACA can really play on the right side of the cube in terms of public information, acting with people. So in terms of acting with people, you can recognize the impact of oppression or other barriers to healthy development. You can assess the influence of public information. You can also act with others who are affected by this to start social media campaigns, to really partner with people. And then on that bottom right domain of social and political advocacy, we can act as change agents to the systems that affect our clients more directly. We can seek out and join with potential allies, and we can provide data and rationales for change. And I think that's a lot of what Amber and Leo were talking about, is some of the data that we may not be talking about. So I want to challenge us all that our role and value as counseling psychologists is to actually do something after this webinar. And I know folks have been doing a lot. So it doesn't have to be change the world. It can just be, what is that next step for you in having some influence on the ACA? It's one step, even one day at a time. And I know for myself, it's very tempting to be like, oh my gosh, I can't believe this is still happening. But even after this webinar, I want to challenge myself to do one more thing. And so I'm happy to throw it back to Bryana for some general questions from the group. Bryana, we can't hear you.
Let's see. Hey there, how about that? Okay, so I was just saying thank you for all presenting, and I'm going to save some time. We've got 5 minutes or so left, 6 minutes. So if anybody has questions that they want to ask the panelists, I think it's important that we have a dialogue and think about how we can bring this back to our respective communities. So we are ready and willing to begin that discussion. So again, attendees, please type your question into the question box on your control panel. It should be on the right-hand side of your screen, unless it is for mine, or at least it is for mine, and you can see your questions there. While folks are thinking about questions, one thing I'm struggling with, and that really resonated with me, was the point about feeling overwhelmed and also not wanting to give into that feeling of overwhelm. And so I was listening to Kendrick Lamar's new album, and he has a line in there that kind of says that very thing, like we were marching in the streets and now it's back to kind of everyday practice. And I don't want that to happen. And I think, and at the same time, there's, something to be said about how long somebody can fight continuously. So how do we engage in self-care and use strategies that can sustain ourselves for the long haul, or that are realistic, or to keep momentum going? And so this, again, kind of like Anneliese's webinar, is one motivation for that. And I appreciate the ideas about ways that activism or advocacy can look across different arenas. So it doesn't necessarily mean protesting or marching, though that also gives me a certain important energy that I can't get anywhere else, but also just in my teaching or in my mentoring. What do I decide to assign as readings to help train future psychologists in the role of advocacy, for example? How can I impart knowledge, broker knowledge, like you were saying, Amber, to people in my called district or whatever, in my Minneapolis area of Congress? How can I speak to my representatives, so on and so forth? And is that useful? I learned calling over emailing, for example, is certainly more effective, it seems, but there are certainly other ways that you can engage. So just wanted to name my process and then put that out to the panelists if you have thoughts around, okay, so what is the what next? How have you been able to sustain yourselves? That kind of thing.
I think what goes along with the what next is also being informed. So I think before this experience, and maybe 5 years ago, I couldn't tell you how my previous senator or representative stood on certain issues, or did they vote for the Mental Health Parity Act. So I think that may be one way to kind of mitigate those feelings of being overwhelmed is sort of participating in webinars like this and researching your members of Congress to see where they stand to give you an idea of where you can engage and how you can engage. But as far as self-care, I've been very just overwhelmed in a good way by my peers in psychology speaking out just on social media. It's like, it isn't just me, working on the Hill, it's the whole community being engaged. So that's always helpful. Like, okay, I'm not the only one obsessing over whatever cable news show I'm watching. Other people are watching it too, and they care. So that's been very helpful for me.
Mm-hmm. And I think what you're saying, Amber, reminds me that, when I've been teaching, I haven't been teaching this summer, but communicating with advisees, I always make sure people have their representatives in their phone. Not everyone's jam is to do, call their senator or their representative. We happen to have Congressman John Lewis down in Georgia, so he actually wants to hear what we have to say. But I think that, really breaking the ice around like making that first phone call. It kind of goes back to what you were saying, Leo, being with the MFP fellows up on the Hill. It's huge. And so asking, taking one person with you, doing the phone call with another person in the room or with a student or a colleague is huge. We don't have to always do this alone. I mean, sometimes I'm sitting with my partner and I'm like, all right, ready, set, go. And she's on a phone and I'm on a phone. And, it just a couple of minutes and it feels minor, but those things add up.
Mm-hmm. Thank you.
Yeah, I mean, I would only add, I think I agree with everything. I think the self-care piece is really important, just, from work-life balance and all of that, trying to stay as healthy mentally as you possibly can doing this sort of stuff. It is easy to get in terms of, the issues in work. I have to now just realize you can't do everything. I can't read every email. That frustrates me. I can't read every email comes out about a bill because it will pass in the House, and the next day you'll have this one, and there's so many different things. There's appropriations, there's issue areas. So I feel overwhelmed oftentimes around that, but I think it's just managing expectations, and I really do like the piece. I think this is what all of us might be saying, the imparting of information. And one of the aspects of, we did this with, we had the Leadership Institute for Women's program, for example, and that's done by a different office, but they had a Hill day, so we took people up to the Hill also. And I've done that for committee members on different governance committees before. So that part of this I really do enjoy, imparting it to members and folks to sort of empower, yeah, that is the word, to empower our constituencies and our members on how to go up there, how to demystify it, because often people might be nervous initially. Either they love it or hate it, they make me really nervous and whatnot, and then they just go and do it, and is that it? And then they really start liking it. So I actually enjoy that piece a whole lot, and just sort of the empowering our members to know that you can make an impact and a difference. So, and I think that's really important.
Thank you. So I do see that there are questions now. I apologize for the delay. The little box was empty for me, but our organizers are on it. So one question, and I realize we're at time. Hopefully nobody gets kicked out. People can stay on to answer. That the web thing won't shut down. So one question is as follows from Dr. Denise Brown. We appreciate all your presentations and contributions. Do you have any recommendations for incorporating advocacy training in grad programs and coursework beyond readings? So I'll just say both questions for the sake of time. So how do we integrate advocacy beyond the readings? And then Dr. Ryan McDermott, thank you for joining us, Ryan, says, I feel like we need to get other fields of psychology and public health together for this important task. It can't all fall on counseling psychologists to address cultural issues.
I'll quickly try to address those two. So one of the things that I did with my students when I was at Akron, we all as a group, or those who were interested, went down to the Ohio Psychological Advocacy Day. So if your state has a state advocacy day, that's a great way to sort of expose students at the state level. So that was very helpful and piqued their interest. And the other question, I 100% agree with Ryan, because public health is well represented on the Hill. The American Public Health Association, we are as well, but they are very well represented. And we know that public health issues have a behavioral component. So I just want to say I agree with that, and I'm open maybe on a different webinar to kind of explore that intersection and what it looks like.
Good question. Good answer. Thank you.
Similar things to Amber. In my courses, I usually have people read something on counselor advocacy. A lot of it comes out of the American Counseling Association, and then have people develop what is, a group project or something they want to do during the semester in terms of advocacy. So giving them a lot of different ideas. And I've had pretty good success with having specific lobbyists come in. So I've worked a lot with the Georgia Safe Schools Coalition, and we have to deal with issues of religion in Georgia all the time. And there's this idea you're not supposed to talk about religion. You're certainly not supposed to talk about it with your representative, but we're in Georgia. So, we've got to be able to know what those arguments are. And so I think having the lobbyist point of view is really interesting. So that was something new. So those are great questions.
Thank you. And then finally, we will send the slides to attendees, so keep that in mind. And then a final, I think, really important question by Jasmine Jenkins. In a nutshell, she's wondering how marches and protests are perceived by politicians on Capitol Hill. Are they impactful? Thoughts about those of you in DC?
Well, it depends on what the issue is and who's protesting. I think that they are having an impact. Look at the conversation always around members not wanting to go back to their districts, around the healthcare piece, get berets and they have to deal with all of it. So all that groceries organizing I do think it makes an impact, and members have to think about it. I think they pay more attention when it happens in their district or if it's coming from their own constituencies or constituencies. Some things I guess can go too far, but I remember the day that McConnell put out the bill. There were people. This was really powerful imaging. You might have remembered they had the disability groups outside of McConnell's office, and they had the images on TV, like actually arresting them and moving them out. And so stuff does make an impact in the broader scheme of things. But again, it's going to depend for a member. If there's a protest on your issue or something you support, you'll like it. If it's not, you won't like it per se. But that's not to be too cheesy about it, but that really is democracy, and that's really, protest and stuff is really what we're supposed to be able to do. In fact, you're supposed to be able to go talk to your members of Congress in any way that you want to.
To prep, yeah, that makes sense. Oh, we're a little bit over time, so we're going to have to end. I'm afraid that the webinar is going to stop and we'll just get cut off mid-sentence. So we'll end here, and complete gratitude for the three of you and for our behind-the-scenes organizers. Thank you for participating, getting us up and running. It's been a long time coming. We had this idea at the Multicultural Summit in January. We were super angry and excited, and it took a bit to get it going, and it's super timely anyways, even though it's in August. I don't even know what month it is, July. So thank you. We'll stay tuned for the healthcare bill to come out and see what it says, and then look forward to continued conversations in the fall. This will not be our last rodeo. Thank you all.
Thank you. Thanks, Bryana.
Thank you to the participants for joining us.
Bye-bye. Thank you.
Bye.